Hello guys, how are you all? I hope all of you are really doing good and welcome back to my channel. I am Dipan, I live in London and I make videos relating to job, HCPC registration, moving to UK and so on. So today's video is really interesting video. It will be about how you can fill up your professional experience part in your HCPC online application. I was getting a lot of queries regarding that, so I thought finally I should make a video on it. If you have not subscribed my channel, please subscribe and press the bell icon. So let's start the video. So when you will start filling up your HCPC online application, there is a section where you have to provide your professional experience, and if you look at closely in that section, they are basically asking you to provide the service users, the kinds of services you have provided or dealt with, your assessment, treatment and evaluation methods. Yeah, so these are the things they are basically looking, and that they'll make sure that you are autonomous, you can do your job on your own independently. This is what they are looking. Okay, so if you don't write your professional experience section nicely and don't give the proper details what they are looking, they might ask you to provide further details, and which will automatically delay your process. So for radiographers, I'll start with radiographers, how you can fill up your HCPC professional experience section. So first of all, you have to start you have to start the section by saying something about your hospital or maybe something about your department, a few lines, and then how many years you're working there and what are the working hours, like weekly hours, how many hours you're working in a week. So this you can start with writing these paragraphs. Okay, so once you have written a brief description about your hospital, your department and your working patterns, you can start describing your job responsibilities or duties in a bullet points. Okay, and in the bullet points you have to make sure that you are providing all the information that HCPC is looking for. So in the bullet points, you can start by saying how you are maintaining proper record of the numbers of procedures you have done, how you are identifying a right patient, how you are explaining the procedure and what you will do to make them calm down, to relax their fear and anxiety, how you are going to position them, how you are going to use radiation protection equipments, um, how you are assessing the patient condition before, during and after the procedure, how you are evaluating and interpreting patients' clinical history, signs, symptoms and lab results, preparation details prior to the procedure, what you will do if any complications and reactions associated with the procedure, and initiate how you will initiate any response in case of emergency, how you will maintain and operate your equipment safely, and what ranges of patient you have dealt with, stable patient, ambulatory, critically ill, traumatic, neonates and anesthetized patients. So you have to mention what kind of patients you have dealt with. So this professional experience section is basically what you have done in your role, or what you have done. You have to just describe all in a bullet points. Okay, so also you have to mention your key area of responsibilities. What is your key responsibility areas, uh, to ensure radiation safety for patients, general population and co-works in the radiation prone zones, and to differentiate between normal and abnormal anatomy, and if you find any abnormal anatomy, what will be your escalation, what you will do, you have to mention about that. And also mention what kind of images you generally produce, like high quality images, and how you maintain any precise record to facilitate immediate and later clarifications if the doctors wants from you. And then you can go on by describing what are the x-ray procedures you have done, if you have done any portable x-ray or theater radiography, what are the theater radiography procedures you have done, and all the modalities you have to mention, what are the studies you have done, like in CT scans, what are the studies you have done. If in fluoroscopy, what are the studies you have done. In MRI, the list of studies or the categories of studies you have performed. So like this, you have to mention all the modalities, studies, uh, like not really elaborately, but if possible, mention some of the studies or mention some of the categories. Specifically, what are the categories of studies, like musculoskeletal, gynae, like that, contrast, plain studies, like that. You have to mention all the studies. And then you can also mention what are the modalities, machine name you have worked with. You can also provide the names of the machine and their little of specification, like MRI 1.5 Tesla, CT scan this much slices, like that you can mention. Also, please don't forget to mention a point regarding the quality assurance of your equipments. What are the quality assurance you do basically? So you have to mention a bullet points how you maintain your equipment's quality. And in addition, you can also add some points regarding, like, if you have supervised, assisted your junior staffs or students, or regarding your interpersonal skills, regarding your if you have attended any continuous medical education, any seminars, just mention it. Not too much elaborate, just you can mention it. So for physiotherapist also, the professional experience section will be like same category. You have to start by saying where you worked, how many hours, and how many years you are working, and then you have to go on saying the patient population you have handled, their medical condition, okay, and then your assessment methods, like physical assessment, video consultations, general assessment or gait analysis, and outcome measures, the scales you used, what are the scales you used, and depending on your specialty, like neurophysiotherapist, MSK physiotherapist, pediatric physiotherapist, you have to mention it. And what are the outcome of treatments, the intervention is used, your care plan, how you have discharged, and what is your referral policies, and then your documentation, your assessment, care plan, observation, goals, management, like that. And don't forget to mention 2 to 3 case studies where you have shown all these things, okay, and any group sessions or any community postings, you can talk about that. So that's all guys, that's all for today. I hope this video will be a little bit helpful for you, and if you need any further guidance or any query, please comment below or contact me in my Instagram, LinkedIn. I'll be really happy to help you. So till the next video, take care of yourself. Bye bye.